Hashimoto's thyroiditis is an autoimmune condition that causes an increase in our antibodies. That increase in our antibodies causes increase in inflammation in our bodies. And what does increased inflammation mean in our bodies? Increased inflammation causes aches and pains. It could be the beginnings of different sicknesses and diseases. First of all, we have to look at the blood tests. That's including the TSH, the free T3, the free T4, and we have to look at the patient's degree of symptomology that they are exhibiting. So that is very important, those two things together. We will treat by medication. There are different types of thyroid medication that's available. And we will treat by other means as well, because there's a lot of inflammation in the patient's body. What happens is we find out that they may be sensitive to different foods. So we do a food sensitivity testing to see what foods the patient may be sensitive to. Also, we have to determine how much stress there is in the body. If the patient is experiencing a lot of stress, then what happens is the antibodies go up in the body. And with the antibodies going up, the inflammation increases and also the symptomology increases. So we look at the blood levels, the symptomology. We check to see what type of foods the patient may be sensitive to, and we also assess the degree of stress that is present. There are different types of stress, and we all perceive stress in different ways. There's personal stress, there's job stress, maybe dealing with the kids, over exercising, is a form of stress. To some people, fasting or not eating well. These are all forms of stress, and they all affect us in different ways. I'm going to give an example of stress. So I see quite a number of school teachers, and during the summer, I rarely see school teachers. They're doing fine during the summer. They're off on vacation. School starts in September, and I start getting phone calls from school teachers in September because their stress levels will rise and their symptomology informs them, the symptomology from their body informs them that they need help because they're uncomfortable, they're having aches and pains. So this is just a perfect example how stress can increase our symptomology and increase our antibodies in Hashimoto's thyroiditis.